the weather in the chat. So we are so pleased to be joined here today by Maki and Jasmine from the Migration Policy Institute. This webinar is offered as a component of the Home Visiting Coordination Initiative housed at Prevent Child Abuse New York. My name is Maggie Dixon. I'm the Home Visiting Coordination Initiative Development Coordinator here. So just a few housekeeping items before we get started. These webinars are recorded and put up on our HVCI website. I will pop the link to the website in the chat. After the presentation, I will send a follow-up email to everybody that registered with some more information about the Home Visiting Coordination Initiative website, a copy of the slide deck or a link to the PowerPoint, and also a survey link. The Home Visiting Coordination Initiative is a component of the PDG New York State B5, and a component of the grant requires data collection and feedback on the activities. So we really appreciate if you attend the presentation to fill out the survey with some information and provide feedback. So I'll be sending out a link to that as well as a few reminders. So I'd now like to introduce the director of the HVCI, Jen O'Connor, to give some remarks and introduce our presenters.
Good morning, everyone, and thank you, Maggie. We're so thrilled that everyone could be here on what apparently is a snowy day in other parts of the state, clear here in Albany at the moment. You know, we've done a webinar on the unique challenges of immigrant families last year, and that was precipitated in part because we know that the last 4 years have been particularly challenging for some families, and that some federal policies have made life a little more challenging. So we contacted Maki Park at the time and asked her if she would do a webinar for us. And she did such a great job that we thought we'd invite her and her colleague Jasmine back to join us this year and talk to us about, again, how to sensitively handle any unique challenges that immigrant families may face as a home visitor going into their home, or at the moment holding virtual home visits. How to be culturally appropriate, how to be aware that one person's experience is not necessarily another person's experience. We believe it's very, very important for home visitors to make that connection with the families that they serve. And we know that the real beauty of home visiting is that it's so relationship based. And we know that home visitors really want to have that connection and to do the best job that they absolutely can with every family that they come into contact with. And so we're really thrilled. The Migration Policy Institute is a nonpartisan organization that works on coming up with new and innovative policy ideas. They are a forum for dialogue, and they do a great deal of research and analysis. And so we're very excited to have both Maki and Jasmine here. And so I will leave it to them to spend about 45 minutes with you. Any questions you have, please put them in the chat and we'll field them a little later. And then we'll turn it back over to Maggie towards the end to do some last minute housekeeping. But thank you again. We're glad that you could join us for this important topic issue. Maki and Jasmine?
Well, good morning, everyone, and thanks so much to Jen and to Maggie for inviting us to speak with you all today. And thanks so much to you all for making the time to join the conversation. We're just really grateful to have you join us, and excited to have the opportunity to speak with you about immigrant families and home visiting. I will just make a quick caveat that I'm home with my 2 young kids right now during their winter break, so hopefully no interruptions, but apologies in advance for any disturbances. So my name is Maki Park. I consult as a senior policy analyst focusing on early childhood policy at MPI. And I'm joined today by my colleague, Jasmine Flores Pena, who is a research assistant at MPI. And much of my work at MPI really focuses on how policies and programs in the early childhood field in general, so ranging across home visiting to childcare and pre-K and beyond, and how these programs and systems can better serve young children of immigrants and refugees, as well as what we call dual language learners, which is any young child who has exposure to a language other than English in the home. So that includes immigrant families, but also a range of other children as well. And on the next slide, just so you all know where we're coming from, MPI is based in Washington, D.C. We are a national, nonpartisan, nonprofit research institute. And within this larger organization, Jasmine and I work within what's called the National Center on Immigrant Integration Policy, where our work is centered on how to improve outcomes for immigrant families in the US across a range of issues that you can see on the next slide. And while we are a national institute, much of our work really does roll out at the state level, especially when it comes to early childhood issues, just because most of the important policies really do exist more at that level. So we put out quite a bit of data, information, and resources for many states, including New York. So we'd just encourage you to link up to our website if you're interested. You can find more information that I hope might be helpful to your work. And we'll be referring to much of it over the course of the discussion today. And I also wanted to say that just coming from a national organization, I always feel a little bit sheepish presenting about work that's happening in New York and so on the ground to a group of folks who are just so much more expert on this work than we are. You know, I've never been a home visitor, but I'm always thrilled to be able to make that connection and to continue to have the opportunity to learn from all the great work that I know you all are doing. So just to say, I'm really looking forward to opening this conversation up to you all to contribute and share with all of us what you've been seeing and experiencing on the ground as we move forward. And I see folks are still introducing themselves in the chat. I hope you'll feel free to send questions and comments our way as the conversation moves on. The last thing I wanted to mention in introducing ourselves and our organization is to call out our partnership locally in New York with the New York Immigration Coalition, or the NYIC, which is based in New York City, and many of you may already be familiar, but they are our local partners who are really our ears to the ground in New York on immigrant issues. They do really powerful advocacy work around early childhood and education issues for young children of immigrants in New York. So also just wanted to call out their valuable presence and make sure you're aware of them as well as a local resource for those of you who may be interested in engaging in advocacy or learning more about state and local policies that affect immigrant families. I think it'll be really exciting at this time. They're probably a great organization to follow to stay abreast of how federal immigration policies are likely going to be changing rapidly in the coming year or so. And then on the next slide, I just wanted now to give you all a quick roadmap of what Jasmine and I will be covering in our discussion. It's daunting to give a presentation for almost an hour. I know it's a very long time to listen to two voices. I thought it might be helpful just to give you all a bit of a sense of structure so you know where we'll be going in the presentation. So first, I'll just be touching on why we're here, why immigrant families and home visiting, why is this an important topic that we care about. Jasmine will then give a demographic overview of immigrant families, just a portrait of who they are, how many, what's the share, some characteristics, as well as some of the key risk factors of immigrant families with young children that make them important beneficiaries of home visiting services. And then we'll move into talking about, what opportunities do we see primarily at the policy level to really expand access and improve services in home visiting. And as part of that, I'll be talking about these 4 brief case studies that we recently put out, just to give some concrete ideas of what's happening in other states and localities. I'll talk a little bit about some opportunities we have on the horizon to stay connected, and then we'll open up to discussion and Q&A. So, launching right in, why immigrant families and home visiting? And here I just want to tell you about how we came to this issue at MPI. While we're actually still reasonably new to the home visiting arena, we've been doing work at the intersection of immigrant issues and early childhood issues for quite a while. And we arrived at this work from a few different angles that all pointed to home visiting as this really key opportunity to lift up immigrant families, and also just a critical area that we think deserves more exploration and examination. So firstly, coming from the issue of parent engagement and early childhood services. we have long recognized the need for more substantive support for immigrant and other limited English proficient or LEP parents as a means for them to be able to meaningfully partner with early childhood programs and staff and be able to build those trusting relationships and effectively advocate for their young children over the course of their educational career. And we've been pointing to the fact that many traditional early childhood programs and preschools, while they say that they want to engage families, they really lack the bandwidth and capacity to provide this support for immigrant families in particular. And home visiting is a natural opportunity to really offer this kind of tailored two-generation approach and serve parent needs alongside their children, which Jasmine will also be speaking to as well in her discussion of demographics. We also came to this issue from our work calling attention to the growing linguistic diversity in the dual language learner population in the US, or what we refer to as super diversity. So as speakers of languages other than English and also other than Spanish are growing in number and share across many states and communities, the need for approaches that can support speakers of those lower incidence minority languages is crystal clear. But providing home language support, which we all know, I think, is best practice, providing that support when there are a dozen or even more languages represented in a program is, of course, logistically complicated. So enlisting parents as first teachers of their young children in that early childhood context, especially in their home languages, is a really critical strategy in this respect. And again, home visiting is very well placed to promote this support and dispel some of those damaging myths about needing to speak only English in the home, which we know sometimes, even from pediatricians, parents are still receiving this erroneous messaging. And I'll be talking about this a bit more in our presentation as well. And I know we talked about this the last time we met, but home visiting is also a really important opportunity and vehicle for addressing and mitigating intergenerational trauma of the types that immigrants are disproportionately likely to experience. Not only do home visiting services have the opportunity to take a trauma-informed lens in serving families who may have experienced trauma and other stressors, but home visitors, because of the kind of trusting and holistic relationships they can build with families, are really well placed to identify families who have a need for trauma-informed services, even those families who may be less likely to seek out mental health support due to a number of reasons. And then about 2 years ago, the National Academy of Sciences released their consensus report on English language learners, including a close look at early childhood needs. And one of their key findings and recommendations was to promote the participation of DLL families in home visiting services to improve their outcomes. But the report found that actually currently home visiting services are underserving these populations and they're just participating at lower levels. So this need and this gap really solidified this as a priority area for us to examine. And then at the same time, once we dove in, we realized that the research base in this area specific to immigrant families was really thin. And it was just really difficult to determine the responsiveness of the field, or even at a minimum, an understanding of which of the major national models was most effective at serving DLLs and immigrant families. So our work really came as a response to what we saw as an important gap in the field and in the research. So that, in a nutshell, is why we've been pursuing this work and why we're here to speak with you. And with that context and introduction in mind, I am going to hand things over to Jasmine to walk you through some of the key demographic information around immigrant families.
Right. Thank you, Maki. So again, my name is Jasmine Flores Pena, and I am a research assistant at the Migration Policy Institute. And I primarily assist on K-12 and early childhood education. So this research kind of comes about from a 2-gen project that a colleague and I were working on, where we were looking at adult education and early childhood education. So this data is tabulated using the US Census Bureau American Community Survey, which was collected from 2014 to 2018. And it primarily looks at parents with children ages 0 to 4. And we collected this data with the intention just to better inform, understand, and more equitably address the needs of immigrant families. because we know that parents are children's most important and first teachers, and that despite their many strengths, they do face a lot of obstacles. So just to paint a picture of what the immigrant population looks like in the US as a whole, immigrants comprise 22% of all parents with children ages 0 to 4 in the United States. And the majority of immigrant parents are Latino or Asian American and Pacific Islander, with 50% of them being Latino and 26% being Asian American Pacific Islander. In the United States, 35% of those parents with children ages 0 to 4 are US citizens. And on the other hand, the majority of US born parents in the United States are white, with 69%. So that's in the United States, but drawing some comparisons to what New York looks like. So in New York, immigrants comprise 33% of all parents of children ages 0 to 4, and similarly to the national data, the majority of parents were Latino and Asian American and Pacific Islander, with 37% being Latino and 27% being Asian American and Pacific Islander. But as you can tell, there are larger percentages of Black and white immigrant parents in New York, and it's also a higher percentage of parents are naturalized US citizens, roughly 10 more percent, 45% of them being naturalized US citizens compared to the national data. And many of them have also long established roots, with 41% of this population having lived in the United States for longer than 16 years. So I feel like this data just tells us that like this population is not a monolith, and there is a diversity in both race and ethnicity, but also like length of residency and documentation status, which all affect how immigrant parents may interact with organizations and seeking early childhood education services, because they may have different depths of knowledge in how to navigate these spaces. So it's important to just sort of know who they are so that our strategies for reaching out to this population cater to those needs. Some of the challenges that they may face can be related to their educational attainment and English proficiency. So in New York, in New York, roughly 3 times, immigrants were roughly 3 times more likely than their native-born counterparts to lack a high school diploma. So that was 19% of the population compared to 7% of US-born parent population that lacked a high school diploma. And despite immigrants representing approximately 1/3 of the total parent population, 60% of them lacked a high school diploma. And there were approximately 215,000 LEP immigrant parents of children compared to 28,000 US-born LEP parents. And 1 in 5 of them lived in a linguistically isolated home, or 1 in 4 of them lived in a linguistically isolated home. And for parents who were LEP and like the high school diploma, that was 1 in 5. So these barriers are compounded and pose barriers to their integration, sort of highlighting the need to address their educational attainment so that we can also prepare them to successfully help their children in their own educational journeys. Alongside the disproportionate levels of educational attainment, immigrant parents were also more likely to face and experience poverty. So in New York, 45% of immigrant parents with children ages 0 to 4 were low income, and they were also more likely to be working poor. And that was 28% of them being working poor, compared to 18% of the US-born parent population. And for those who were both LEP and low income, this was 30%. So this kind of shows a strong relationship between poverty and low levels of formal education, and point to the value of addressing their basic education, because sometimes programs focus on just focusing on their language attainment, but it can also be more than language attainment, and it goes back to the education that they may have received. If they have less than a high school diploma, they may be needing programs that address that first, so that they can work in other kinds of jobs. And then lastly, when it came to digital access, which is very crucial during these times where children are participating in remote learning, immigrants were disproportionately less likely to have access as a total parent population. So that was 35% of parents with children ages 0 to 4 who lacked access to the internet, and 37% who lacked access to a computer or laptop in their home. When you compared them as like, they were more equal or like a little bit behind. These are the total parent population, but when you look at the the population as a whole, and you see disproportionately, is when you get these numbers. And that's all I have.
Great, thank you so much, Jasmine. And again, feel free, if anyone has questions as we move through this information, to put questions in chat. I wanted to talk quickly about some of the terminology. The linguistically isolated households in particular it's a data point that we often use, which just indicates that there is nobody over that is adult age that speaks English well. And that's just an important metric that we often look at just to show their likelihood of struggling to navigate services or even know what services may be available to a family. But with that information about immigrant families in New York in mind, I just wanted to move on to talk to you about some of the opportunities to improve access and services for immigrant families in home visiting. And much of what I'll be speaking about is really drawn from 2 policy briefs that you can find at our website for those who are interested in diving deeper. The first that you see linked here goes over broader recommendations at national and state levels for how to improve home visiting services for immigrant families. And much of the recommendations here really focused on the need for improved data collection. We recommend, for example, that MCV require languages spoken and LEP status as indicators in the state needs assessments that are collected as part of the federal funding process. In general, both at administrative and program levels, having that data that's disaggregated along these lines would go such a long way in revealing existing disparities, as well as understanding program quality and generally promoting equity for these populations. Much of the research base through the Home V effort, for example, also just doesn't look specifically at outcomes and experiences of minority populations, which also makes it difficult to know which kinds of programs are most effective and successful in serving immigrant families. So as an example, we at MPI have been tracking the information that's been coming out about how home visitors are faring during the pandemic, just to try to find some promising practices and see what the situation has been like specifically for immigrant families and other families that might have limited digital access, as Jasmine just illustrated for us. And of course, those that might also have limited language access, which can pose even greater difficulties than usual in virtual visits. We also know that immigrant families are more likely to be serving as essential workers in many industries. So this is just an area of concern for sure, as we consider what kinds of beneficiaries are or are not accessing these services right now. Unfortunately, though, as of now, we haven't seen any information or data that provides information about families who are limited English proficient or who speak a language other than English in the analyses that we've seen. And these kinds of barriers haven't been an area of focus in the narratives that we've seen as well. That said, I anticipate that there is just a lot of great work and innovative practice on the ground that's addressing these barriers, and as programs and staff are constantly evolving and meeting that need, just that they're not necessarily being captured in research and data, which is such a shame because other folks can't learn from what's happening. So we'd be really interested in opening this up to you all and hearing from all of you about what you've been experiencing in the field as we seek to understand what the situation looks like in the field. And then on the next slide, this more recent brief that you see linked here goes into more specific local and state policies and approaches that are making efforts to support immigrant families through home visiting. For this work, we did a focused look at 4 sort of mini case studies that you see laid out here. I won't have time to discuss them all in depth today, but I wanted to tell you just a little bit about each case and then do a deep dive into the work in Illinois that I thought might be of greatest interest to this group. But don't hesitate to ask questions or reach out if you'd like to learn more about any of the other initiatives listed here. So I'll start with Massachusetts, since I just left off talking about the McVie state needs assessments and how beneficial it would be to collect information about languages spoken to make sure that immigrant families are visible, both in terms of their needs, but also in terms of how their services are understood by administrators. And an important caveat to state here is the fact that, of course, gathering immigration status is very sensitive information. So we need other proxy data to be able to identify these families as well as the diversity of their experiences. And that's why languages spoken, as well as limited English proficiency, for example, are good indicators that can give us insight into where immigrant communities are and what their experiences are. As of now, I believe Massachusetts is still the only state that gathered and reported on information in this way in their 2020 federal needs assessment. And some of the indicators that Massachusetts included are, first, students whose first language is not English. Second, individuals with limited English proficiency. Third, mothers who are foreign born. And 4, residents who are refugees and asylees. So these data points, they factored into their community risk ranking, which is used to help identify at-risk communities, which are to be prioritized for McVie-funded services. So that's Massachusetts. In San Diego, at the county level, through their local First 5 commission, similarly, the county included immigrant and refugee communities and explicitly targeted them for services because of their multiple risk factors. San Diego is a huge immigrant receiving community. They included them just as part of the list of populations that they hope to reach through their home visiting work. So it's on the list along with low-income families and other at-risk populations. San Diego has also prioritized a diverse home visiting staff, and they have poured resources into translation and interpretation to make sure that they're able to meet these targeted goals. So as you may know, a lot of the national home visiting models don't have translated materials in languages beyond Spanish at best. But in San Diego, they themselves are providing those translations and making sure that those curricula and information are accessible to the immigrant families that they're serving. And then in King County, Washington, which is the county that includes the city of Seattle, which is actually where I'm based, this is another county initiative through what's called their Best Starts for Kids program. And what we highlighted there is the way that King County designed their funding and RFP process for home visiting programs to counteract the fact that most research and evaluation of home visiting models haven't traditionally accounted for the needs and experiences of diverse communities. So what Best Starts for Kids does includes providing funding to 3 types of programs. The first type is traditional evidence-based programs that have been proven through rigorous research, which are being funded everywhere. The second is a tier called evidence-informed programs, which have at least one comparison study showing effectiveness, so includes more emerging programs. And then the third, and this is the innovative piece, are community designed programs, which is a term they created. These are programs that are more often tailored to suit the needs of local residents and may not necessarily have a research backing. But in this way, they're much better able to support innovative and culturally specific strategies that are really reaching underserved populations. So how do they do this? In their process, they value innovative outcomes in addition to traditional measures. So one of the first things they look for is just an organization's embeddedness in the communities they serve. So things like the match between their staff and the families that they serve in terms of race and ethnicity. And in this way, they're able to fund smaller community-based organizations that have less bandwidth and organizational capacity that's usually required even just to apply for funds, which, as you all know, just takes forever and a day and just so much time and resources even just to get that application in. So in this way, they're able to even out the playing field. And through this effort, they've also been able to partner with a range of very culturally specific organizations that are quite small, but have very trusting relationships with their communities, which means that they're able to hit the ground running. And then finally, I'll speak more in depth about the work we learned about in Illinois. So there, on the next slide, we've been really excited to learn about the work that's been done under the Illinois State Board of Education's Early Childhood Prevention Initiative, which has also taken the step of including indicators that are relevant to immigrant and refugee families in defining their target population locally, similar to what we've been advocating for at the national level. But by taking into account factors like parents' level of English proficiency, which again has that influence on their ability to access services, also things like their literacy levels, the Prevention Initiative has been able to identify important risk factors and opportunities for intervention that might otherwise be missed. So this initiative, similar to King County, also funds a mix of models, not only those that are already considered evidence approved by McVie, but also emerging models. And this includes a program called Baby Talk, which we focused on in our brief. And they are also in the process of really building the evidence base for efficacy with specific populations that's currently lacking across the board. And the Prevention Initiative's explicit efforts to support families who've experienced trauma and other stressors in a holistic way is what I wanted to dive into right now. So why might we want to focus on the overlay of early childhood trauma in immigrant families? So on the next slide, I talk a little bit about how immigrants arrive in the United States through a wide range of migration experiences. This includes the experiences of refugees who, by definition, are fleeing violence and persecution in their countries of origin, asylum seekers who have in many cases undergone dangerous journeys to arrive at their current destination and have undergone or are undergoing months or even years of uncertainty as they wait for application decisions. This population also includes mixed status families who have one or more unauthorized members who are likely to experience psychological distress and economic instability, in addition to being less likely to be able to access important services that can benefit them and their young children. And we also want to be mindful that under the recent administration, even those families who have full legal status were likely to experience fear, misinformation, discrimination, a host of other negative stressors that can have severely negative impacts on their socio-emotional well-being and the healthy development of their young children in what can be a difficult environment to navigate as new rules and regulations have constantly been in flux in recent years. And then in the next slide, I just wanted to discuss the likely under-identification of trauma among young children of immigrants in early childhood services. And this is due to a number of factors. One issue is the fact that instruments such as the ACE survey, which screens for adverse childhood experiences, are less likely to identify the types of experiences that young children of immigrants and refugees may be exposed to, just because these surveys are largely focused on issues within the household environment. So many of the types of migration, resettlement, and acculturation related issues that immigrants are likely to face are not going to be picked up by such a survey. Relatedly, many mental health screening tools, including standardized tools that are used to screen recently arrived refugees, are not appropriate or intended for use for young children, which means that there's simply no way for many service providers, such as those working in refugee resettlement agencies, to know whether young children have experienced trauma. And then a lack of linguistic and cultural competence across services, including early childhood programs, but also mental health services as a whole, This also means that caretakers, teachers, and other staff in classrooms might miss some of the indications of trauma due to a lack of meaningful communication or cultural misunderstanding. So besides this lack of competence, we also know that children of immigrants are less likely to be accessing early childhood services at all. So not only home visiting, but across the board. And that could otherwise be an important touch point to connect them with other supports, including mental health services. So just in general, this is an underserved community in early childhood as well as in mental health. Minority populations, including immigrant populations, are also just less likely to seek mental health services overall, again, for a number of reasons, including that lack of meaningful cultural relevance, as well as cultural stigmas around mental health issues. And then finally, as I mentioned in discussing the lack of appropriate screening tools, the refugee resettlement sector overall has very little support in place specifically for young children, especially around provision of socio-emotional and mental health supports for the youngest children alongside their mothers. So some of you may be familiar, I know there are some refugee serving organizations in here, of the kinds of services that are required for refugee families as they arrive in this country. And there's very little support in place, in particular for the youngest kids as part of that. So home visiting programs are really unique in their ability to address intergenerational trauma and maternal mental health challenges, as well as to provide mental health supports, both outside of a clinical setting as well as through warm referrals to mental health providers. As you all likely know, mental health issues are often stigmatized in different cultures, including in our own culture here in the United States. And the ability to address the challenges that immigrant and refugee mothers may be facing in a comfortable and normalized setting can go a long way in mitigating some of the negative effects of maternal depression and anxiety and uncovering more serious issues that might otherwise go unaddressed. And I know that home visiting can't do everything. I just wanted to mention that here. And I also believe that many home visitors are already doing this work even without being funded or necessarily trained to provide that support. So we're just really interested in knowing more about how can we make sure that this work is supported at a policy level similar to what they're doing in Illinois. So on the next slide, we'll talk more about the work that's being supported by the Prevention Initiative and implemented by Refugee One. This is a particularly exciting initiative because it brings all of these issues together in one program and under one roof that's really designed to meet these specific needs at the intersection of immigrant issues and early childhood issues. So Refugee One is the largest resettlement agency in Illinois. And their wellness program was the first mental health focused service that was funded by ISBE to deliver home visiting services. So what they do is they screen all of the refugee families with young children that they're already serving, and they're able to systematically deliver their baby talk program to interested families to support their socio-emotional and overall well-being. The program's diverse staff includes 4 clinicians, a psychiatrist, designated interpreters, in addition to trained home visitors, and all of the staff are trained on trauma-informed practices specific to these populations. And I unfortunately don't have time to go into their program model, but I hope many of you may already be familiar with the program. And I can also point you, I can send along to Maggie a webinar that we ran in partnership with the program a little while ago for those of you who are interested in learning more. For now though, before we close kind of the presentation piece, I just wanted to mention on the next slide an ongoing initiative that we're standing up just now. We're excited that the Alliance for Early Success, which is a national network of state early childhood advocacy organizations, they're supporting us in facilitating a learning network around home visiting for immigrant and refugee families, essentially for any stakeholders that are interested in exploring and learning more about this issue. This is open to administrators, program staff, policymakers, really any stakeholders engaging around home visiting who are interested in exploring the overlay of these services with immigrant issues. It's a fairly light touch network, meaning we ask very little of you. But it's an opportunity for folks to be able to stay in touch through an email listserv, and we'll also be hosting 1 or 2 national gatherings around specific issue areas. Similar to this conversation here, except much more interactive. These gatherings will of course be virtual, just given how things are looking right now in the coming year. So if you'd be interested in learning more about this project, I think the easiest way is just to reach out to me or Jasmine directly. My email is at the end of this presentation, and we can just keep you in the loop as this comes together. But for now, I did want to leave some time for discussion and questions, and really hopefully hear a bit more from all of you about the great work that's happening in your organizations, and to know if there's work that you want us and others in this space to know about.
And Maki, before I forget, I also wanted to let you guys all know that MPI has developed fact sheets on the 30 most populated states with immigrants, and all the information that I provided today on like the demographic on income and poverty will be available on MPI's website, I think next month. So there will be a US fact sheet and a New York fact sheet if you guys want that data.
Thanks, Jasmine.
Thank you very, very much to you both. This was a very informative presentation to just kind of learn about not only the landscape in New York State, but just also what other states are doing and what's going on there. I am happy to include in the follow-up email any other resources. You mentioned the webinar on Refugee One from Illinois. I'm happy to link to that if you just want to send me an email with that info. So please type questions or comments. I see a few comments kind of trickling in the chat, and Jen and I are happy to facilitate.
Let me start with one that I think is really very timely. So we have someone who's asking, do health and safety laws protect immigrant workers during this public health crisis? And how are home visiting programs dealing with people that don't have health insurance coverage at the moment? So 2 slightly different questions.
Is that a question about the home visiting staff themselves, or is that more about beneficiaries? Or I can just try I actually have limited, unfortunately, information on this piece.
Mm-hmm.
Essentially, just similar to what I was saying, we sadly don't have funds to do field research, and so much of what we're learning is dependent on desk research, and we do not know a lot about how home visitors right now are evolving their services in the midst of the pandemic. I will say, and this is kind of in combination with another question that talks about, or it's not a question, it's a comment. I'm seeing a comment that says it's critical that all immigrants know their rights at work and have the information and protections they need to ensure their health, safety, and well-being during this unprecedented time. And for home visiting staff, which I think is so critical, there are a lot of really great work-focused and employment policy-focused organizations, you may already know about them, that are doing a series of Know Your Rights trainings, both in terms of, for example, accessing PPP funds, but also, you know, just in the midst of the pandemic, I think it's hard to know what kinds of rights do folks have to keep themselves safe. Family Values at Work is a great organization that's running these kinds of trainings in multiple languages, and I believe have done training specific to immigrant workers as well. And I would imagine that they also have resources for beneficiaries, talking about how staff can support folks that they're working with who don't have health insurance coverage. And Jasmine, feel free to jump in if you know something additional, but that's the best answer I've got right now. I know it's not very satisfying.
No, thank you for that. I appreciate that. And I think also there are specific questions that we can try to get the information, the answer to later. Please let us know. I would think too, in terms of insurance coverage, it really depends on what program you're talking about. So we're happy to facilitate a conversation with program representatives as well, if that's something that folks are interested in after the call. We're happy to help. Two questions here about bilingual service providers. And there are more comments, kind of a lack of bilingual service providers, how to access them, I think, and also, the complications that arise from having an interpreter in a session, how awkward maybe that becomes, and a kind of lack of privacy there. So any ideas about increasing access to bilingual service providers?
I think this is exactly the kind of thing that really requires explicit support and funding. Bilingualism is a skill that I think is always undervalued. And in many cases, folks are, providing translation and interpretation on the fly. In the mental health field, I think there really is a need for folks who are trained up specifically on the content, as well as having, that the language skills. And I think that's one thing, for example, that Baby Talk is doing really well, is that they have designated staff to circumvent confidentiality issues, as well as that disconnect of, when you're having an intimate moment and have that trusted relationship, and then an interpreter comes in and really just kind of just shatters that feeling of safety. And this is why I think, we really just need to make the case that this is a specific area that needs to be funded, and it requires a lot of resources. There's a shortage of linguistically competent staff in early childhood overall, even in early childhood classrooms. I think there are a lot of diverse providers, but it's hard to ensure that they're continuing to get the credentials they need to stay in the field as things become more professionalized. And it's a complicated issue too, because I think one of the things that's so wonderful about home visiting is that in many cases they do have a more diverse staff, because maybe the professional credentials aren't quite as stringent as they would be in a pre-K program. Of course, as the field becomes more professionalized, which in general is a wonderful thing, there needs to be attention paid to who's in the field. How do we retain all of the incredible value that Immigrant and other bilingual providers are bringing to the field, and how do we make sure that we bring them along and get them the credentials they need? So I think in general, there's just a need for advocacy and continued messaging that these are incredibly valuable skills. And just because someone is bilingual doesn't necessarily mean that they, having them in the room means that you'll be able to provide linguistically competent services. It's that mix of content and training on the issue area alongside with having the skills to interpret and translate.
Thank you. Another question here about resources. Are there any resources that a parent who does not speak English can access to support their child who is in school and not being able to provide the support and guidance with school and homework for their child?
That's such a great question. And it's like such an emotional question for me, because I feel like this is what we're living every day with my child's school. And how crazy is it that there aren't those supports, that are clearly available to every parent, especially now. It's not just providing the support and guidance with homework, it's really facilitating virtual school for a child. And that partnership between teachers and parents is more important than ever. I can't speak to what's happening in New York. In Seattle, we do at the very least have a tech helpline that's being translated into multiple languages. But really, they only deal with even just the tech questions of what do you do when your child gets kicked out of the Zoom meeting. I think, that's going to vary district to district and state to state in terms of what kinds of supports are being provided. I don't know if others on this call can speak to that, but this is exactly the kind of disconnect that we're talking about when schools have all this lip service and these policies written that say, oh, we really value partnership with our families, and of course we want to make sure that this is a team effort. But if you don't have anyone on your staff or in the classroom that speaks a parent's language, how are you going to do that? I feel like it's an enormous undertaking now more than ever. And this too is where we really need funding. You know, this work can't happen without dedicated staff and without dedicated resources and training. And as far as I've seen, it's really not happening at the level we need. And, you know, Jasmine showed that information about technological access. And then when you throw that up against limited English proficiency, it's just the barriers that families are facing seem insurmountable right now. Thank you for that question. And I'm sorry, I don't have a better answer.
No, thank you for your answer. I just put the New York State Education Department website in the chat. It looks like there's a lot of guidance on there, but I couldn't tell you if it's helpful or not. So we'll put it up for others to decide. But I also think it depends kind of not just school district to school district in New York, but school building to school building. Certainly what I've found with my own personal experience, it really depends on how the school superintendent and the principal are handling things. So it's very, very unique.
Yeah, and I'll just say, I mean, I really think it is about making noise about these issues. And if folks have instances of disconnects and resources that are missing for immigrant families, please do reach out to me. Like, we'd like to shine a light on that and find out more and see how we can bring that to the state level so that the folks who are making decisions about these issues really know what's happening. I feel like so many times that there's just this disconnect between the policies that are being made and what's really happening on the ground. So I would just encourage people to stay in touch as they're able.
Well, I encourage anybody to, I don't see any more. I see a couple comments about how people are working with in-school translators to assist with proper translation. So people are volunteering some steps that they've taken to address some of these issues. But anyone feel free to unmute and share in the conversation. If not, this has just been a lovely forum to kind of talk about these issues and learn a little bit, but we can give folks a couple minutes back in their day if there are no further questions. I just want to thank you so much again, Maki and Jasmine. This has been very informative. And yes, to questions in the chat, the presentation is being recorded. We have an HVCI website. I can go ahead and pop the link to that in the chat, or Jen can as I'm speaking. But we have a dedicated YouTube channel that houses all of our HVCI work that we link to on the HVCI website. I'll send a link out to it. And we will also send follow-up materials, including the presentation, any resources that were mentioned during the discussion. I'm sure Maki and Jasmine will be sure to send them over to me so I can pass them along. And again, we will be including a link to a survey that you can just provide some feedback to us about the webinar offering as a component of the grant that this webinar is offered under. So thank you very, very much, everyone. I'm going to go